The American healthcare system stands as the most spectacular monument to human cruelty ever erected in peacetime, a vast machine designed not to heal the sick, but to extract maximum profit from human suffering. It is a system so perfectly perverted that Victorian workhouse administrators look charitable by comparison, so efficiently predatory that it turns the Hippocratic Oath into a bitter joke. First, do no harm. In America, it's first, check their coverage. Consider the beautiful simplicity of the con. Take the one thing people will pay anything for, their lives, their children's lives, their freedom from pain, and then build an impenetrable bureaucracy designed to deny them access to it after they've already paid. It's not enough to charge them. You must charge them and then refuse to deliver what they've paid for. It's like running a fire department that charges for coverage, but then declares your house pre-existing when it actually catches fire. The numbers alone should trigger a revolution. The United States spends $13,000 per capita on healthcare, double what Germany spends, triple what the UK spends, quadruple what South Korea spends. And what do we get for this extraordinary largesse? Lower life expectancy than Costa Rica, higher infant mortality than Slovakia, worse health outcomes than any developed nation and most developing ones. We're paying Rolls-Royce prices for Pontiac Aztec results, that hideous crossover that topped every worst car list for a decade, except at least the Aztec would actually take you somewhere, which is more than American healthcare can promise. But the true genius of the American healthcare system isn't just that it's expensive and terrible. Plenty of things manage that. No, the real achievement is that it's expensive, terrible, and specifically designed to be both. This isn't incompetence, it's malice. This isn't failure. It's the system working exactly as intended. Take the beautiful innovation of prior authorization, wherein insurance companies, staffed by people whose medical expertise extends to denying claims, get to override your doctor's medical decisions. Your physician, who went to medical school, completed residency, and has examined you personally, says you need a medication or procedure, but some anonymous bureaucrat with a checklist, possibly in a call center thousands of miles away, gets to say no. It's as if we let insurance adjusters override airline pilots about whether the plane needs maintenance. The denial industry, and make no mistake, it is an industry, has developed its own ecosystem of suffering. First, they'll deny the claim automatically, hoping you'll give up. If you persist, they'll demand documentation. When you provide documentation, they'll say it's insufficient. When you provide more, they'll say it's the wrong kind. When you finally provide exactly what they asked for, they'll say the deadline is passed. It's Kafka's The Trial, but with chemotherapy. And should you have the temerity to get sick without proper documentation of coverage, God help you. The bills will arrive like cluster bombs, one from the hospital, one from each doctor who glanced at your chart, one from the anesthesiologist you never met, one from the radiologist who read your scan from home, one from the lab that processed your blood. Each will be for an amount that bears no relationship to reality. $47 for a single Tylenol, $5,000 for a 10-minute ambulance ride, $30,000 for an emergency room visit where they gave you fluids and sent you home. The prices themselves are fiction, of course. The hospital charges $10,000 for a procedure, knowing the insurance company will negotiate it down to $2,000, which is still 5 times what it actually costs. But if you don't have insurance, you pay the full fictional $10,000. It's the only industry where the price depends not on the service but on who's asking, like a bazaar run by psychopaths. The propaganda machine that maintains this system is a masterwork of manipulation. We have the best healthcare in the world, they cry, which is true if you're a billionaire who can afford the Mayo Clinic's executive health program. For everyone else, it's like claiming you have the best restaurant in the world because there's caviar on the menu that no one can afford, while the majority are eating from dumpsters. But under socialized medicine, you'll wait months for treatment, they warn, as if Americans aren't already waiting, not for treatment, but to save enough money to afford it, as if people aren't already rationing insulin, cutting pills in half, skipping doses to make prescriptions last longer, as if cancer patients aren't already launching GoFundMe campaigns, begging strangers on the internet for the privilege of not dying. The British wait a few weeks to see a specialist for free. Americans wait forever because they can't afford to see one at all. But at least our wait times are efficient, infinitely efficient, because you can't measure the wait time for care you never receive. But government healthcare is inefficient, they shriek, conveniently ignoring that Medicare, our government-run program for the elderly, has 2% administrative costs, while private insurance companies spend 20% on administration, which is a euphemism for denying claims and executive bonuses. The inefficiency isn't in government, it's in having a parasitic middleman whose entire business model depends on collecting premiums and not paying for care. Every other developed nation on Earth has figured this out. France, with its supposedly impossible socialist healthcare, has better outcomes at half the cost. Japan covers everyone for less than we spend just on emergency room visits for the uninsured. Even Cuba has lower infant mortality than the United States of America. But sure, tell me again how the free market is the solution, while Americans ration insulin like it's wartime. The insulin racket deserves special mention in this carnival of cruelty. The same insulin that costs $30 in Canada costs $300 in America. The same insulin that Frederick Banting sold the patent for in 1923 for $1 because he believed it belonged to the world. That insulin. Drug companies have made minor tweaks to extend patents and jack up prices on a medication that diabetics need to not die. It's like if someone patented water and then charged $100 a glass to people dying of thirst. And the American people, bless their propagandized hearts, defend this system even as it bankrupts them. They've been so thoroughly brainwashed that they think paying $500 a month in premiums for the privilege of having a $10,000 deductible is freedom. They've been convinced that the ability to choose between insurance plans that will all equally deny their claims is liberty. They wave their flags and declare that dying of preventable diseases is the American way. The reality? Polls consistently show that 70% of Americans support universal health care, including a majority of Republicans. But what the people want and what the people get are two different things in this democracy of ours. The health insurance industry spends $700 million a year on lobbying. That's nearly $2 million a day to ensure that Americans keep dying profitably. The executives of these insurance companies make salaries that defy comprehension. The CEO of United Health made $142 million in 2021. That's $68,000 an hour, including the hours he was sleeping. He makes more in a day than most Americans see in a year, and he makes it by ensuring those Americans can't see a doctor. It's blood money, quite literally. Every denied claim, every rejected procedure, every person who dies because they couldn't afford treatment is a rounding error on his quarterly bonus. The hospitals are no better, transforming from places of healing into profit centers that happen to have beds. They're run by MBAs who've never touched a patient except to check their wallet. They optimize for billing, not healing. They'll spend millions on a new wing named after a donor, while nurses work double shifts because they won't hire enough staff. They'll invest in robot surgery systems for the publicity, while their emergency rooms look like something from the developing world. And then there's the special American innovation of medical bankruptcy, a phrase that exists nowhere else in the developed world, because nowhere else allows medical bills to destroy people's lives so thoroughly. Over 500,000 Americans declare bankruptcy every year due to medical bills. These aren't deadbeats or wastrels. They're people who had the audacity to get cancer without first becoming millionaires. They're people who thought their insurance would actually insure them, only to discover that coverage is not the same as care. The cottage industry of medical debt collection is particularly vile, buying up medical debt for pennies on the dollar and then hounding people to their graves for money they don't have. They'll garnish wages, seize assets, and destroy credit ratings over bills that are often errors, duplicates, or already paid. It's vulture capitalism at its most literal, feeding on the carrion of human misery.